Medical billing is designed to be confusing, and there are specific traps that hospitals and insurance companies use to extract money from patients who don't know how to fight back. And these traps are costing you thousands of dollars you shouldn't have to pay. Trap number 1. The upcoding scam, where you're charged for services you never received. Hospitals bill for higher levels of service than what was actually provided. You had a basic 10-minute office visit, but you're billed for a complex 45-minute visit. You had a simple procedure, but you're billed for the most complex. Here's how to catch it. Demand an itemized bill showing every charge with CPT codes. Then research those codes online to see what services they represent. If you're being charged for a level 5 office visit when you were in and out in 15 minutes, that's upcoding. Challenge it. Call the billing department and dispute charges that don't match the actual service provided. Many hospitals will reduce charges when challenged because they know the billing was inflated. Trap number 2. Duplicate billing, where the same service appears multiple times. The same procedure, medication, or supply gets billed 2, 3, or 4 times. Sometimes it's an error. Sometimes it's intentional, hoping you won't notice. Either way, you're paying multiple times for something that happened once. Here's your protection. Review itemized bills line by line. Look for duplicate entries. Same date, same service, charged multiple times. This is shockingly common. Studies show that up to 80% of medical bills contain errors, and duplicate charges are among the most frequent. Highlight every duplicate you find and demand removal. Don't assume the hospital will catch their own mistakes. They profit from these errors. Trap number 3. Bundling violations, where you're charged separately for services that should be included. Many procedures include multiple components that are supposed to be billed as a package deal, but hospitals often unbundle them and bill each component separately, dramatically increasing the total cost. For example, a surgery includes anesthesia preparation, the surgery itself, and immediate post-op monitoring, but you're billed separately for each instead of one bundled rate. Here's how to fight this. When you get a bill for surgery or a major procedure, ask if all the charges are appropriate or if some should have been bundled. You can also report suspected unbundling to your insurance company. They hate this because it costs them money too, so they'll investigate. Medicare has specific bundling rules, and violating them is fraud. If you're learning how medical billing is designed to overcharge you, hit subscribe. We're exposing the traps that cost patients thousands in unnecessary charges. Trap number 4. Balanced billing, where out-of-network providers charge you the difference. You go to an in-network hospital, but the anesthesiologist, radiologist, or pathologist who treats you is out of network. Insurance pays their contracted rate. Then the provider bills you for the difference between what insurance paid and what they charge. This can be thousands of dollars for providers you never chose and didn't know were out of network. Here's what changed. The No Surprises Act now prohibits most surprise balance billing, but enforcement isn't perfect, and some providers still try. If you get balance billed for emergency care or for out-of-network providers at in-network facilities, refuse to pay. Cite the No Surprises Act. File a complaint with your state insurance commissioner. Most of these bills are now illegal, but providers send them hoping you don't know your rights. Trap number 5. The Precertification Denial trick, where insurance claims they never approved treatment. Your doctor gets pre-authorization for a procedure. You have surgery. Then insurance denies the claim, saying it wasn't pre-authorized or wasn't medically necessary. Now you're stuck with a massive bill for a procedure you thought was approved. Here's your protection. Get pre-authorization in writing. Don't accept verbal confirmation. Get a reference number and written documentation that the specific procedure with specific CPT codes was approved. Keep copies. When insurance denies, you can prove it was pre-authorized. Also, if your doctor's office handled pre-authorization, that's their responsibility. If they got it wrong, sometimes they'll write off charges rather than make you pay for their error. Trap number 6. Facility fees that appear out of nowhere for routine office visits. You see your doctor at their office like always, but suddenly there's a facility fee on your bill, sometimes $200 to $500 on top of the regular visit charge. What changed? The hospital bought your doctor's practice. It's the same office, same doctor, same visit, but now it's technically a hospital outpatient department, so they add facility fees. Here's what you can do. If you get hit with unexpected facility fees, call your insurance and the provider. Some states have laws limiting these fees. You can also switch to a different doctor not owned by a hospital system. Hospitals acquire physician practices specifically to charge these facility fees, which can double or triple the cost of routine visits. Trap number 7. The medical necessity denial, where insurance refuses to cover recommended treatment. Your doctor says you need a test, procedure, or medication. Insurance denies it as not medically necessary. You either pay out of pocket or go without needed care. Insurance companies deny 15 to 20% of claims, many inappropriately, betting that patients won't appeal. Here's the secret: appeal everything. First-level appeals succeed 40 to 50% of the time. If that fails, request external review. An independent doctor reviews your case. External appeals succeed 30 to 40% of the time. Insurance companies count on you giving up. They deny claims they should pay, hoping you won't fight. Your doctor can help by writing detailed letters explaining medical necessity. Don't accept the first denial. Appeal until you win or exhaust all options. If these billing traps are opening your eyes to how you're being overcharged, make sure you're subscribed. We're giving you tools to fight back and save thousands. Trap number 8. Incorrect insurance information leading to out-of-network charges. The hospital has outdated insurance information in their system. They bill your old insurance or bill you as out-of-network when you're actually in-network. You get a massive bill that should have been covered. Here's your defense. Always verify your insurance information at every appointment and hospital visit. Bring your current insurance card. Confirm they have the correct policy number and that your provider is in-network for your specific plan. After receiving care, check that claims were submitted to the right insurance. If you get incorrectly billed because the hospital used wrong insurance information, dispute it. They need to resubmit to the correct insurance and adjust your bill. Trap number 9. The self-pay discount deception, where paying cash costs more than negotiating. When you can't afford a bill, hospitals offer payment plans at full price. But if you had asked up front about self-pay discounts, you might have gotten 30 to 50% off. The trap is that once you're billed, discounts disappear and you're stuck paying full price over time. Here's the strategy. Before agreeing to any procedure, ask about self-pay rates if you're uninsured or have high deductible insurance. Many hospitals charge self-pay patients less than they bill insurance because they avoid insurance company overhead. Also, after you receive a bill, before paying anything, call and ask about financial assistance programs, charity care, or discounts for paying in full. Hospitals would rather get 50% immediately than chase you for 100% they might never collect. Bonus trap. The collections threat that pressures you to pay disputed bills. You're disputing a bill as incorrect or excessive. The hospital threatens to send it to collections, ruining your credit. This pressures you to pay rather than fight, even when the bill is wrong. Here's what they don't tell you. Under new rules, medical debt can't appear on credit reports for at least 6 months, and debt under $500 never appears. If you're actively disputing a bill, document everything: your disputes, the hospital's responses, evidence the bill is wrong. If they send a disputed bill to collections, you can sue for violations of the Fair Debt Collection Practices Act. File complaints with your state attorney general and consumer protection agencies. Don't let collections threats force you to pay bills that are incorrect. These 9 traps are built into the medical billing system to maximize revenue extracted from patients. Hospitals and insurance companies profit from complexity, confusion, and patients who don't know their rights. The system assumes you'll pay whatever you're billed without questioning it. Smart patients know that medical bills are negotiable, errors are common, and fighting back works. Every bill should be reviewed carefully. Every error should be challenged. Every denial should be appealed, and every suspicious charge should be questioned. The thousands of dollars you save by avoiding these traps is money that was never legitimately owed in the first place. It's just profit extracted from patients who didn't know how to fight back.